I read a study recently featuring a term I had not heard or seen before, disproportionate beef eaters. The study was done by Drs. Amelia Willits-Smith, Diego Rose, and colleagues at Tulane University. So who are such beef eaters and how are their consumption patterns associated with environment and climate change? Welcome to the Leading Voices in Food podcast. I'm Kelly Brownell, Professor Emeritus of Public Policy and Director Emeritus of the World Food Policy Center at Duke University. Today, we're joined by one of the authors of that study, Dr. Diego Rose, who is Professor and Nutrition Program Director in the School of Public Health at Tulane. Diego, it's nice to have you back for another podcast. Thanks so much for being with us.
Well, thanks.
Well, you and your colleagues and your students do the most interesting work on really important issues, how diet lies at the intersection of health and environment. And this sort of work is so important because there's a lot of talk about it, but not enough empirical work to really make policy decisions. It has been done, at least regarding some questions, and you're helping fill that gap. So I'm really delighted you could talk to us today. So let's start talking about this study. Give us some context, if you would. Why did you set out to study the characteristics of disproportionate beef eaters?
Kelly, I've been doing this work for about 7 years, a connection between diet and climate change. And in the early days when I would do presentations on this research, I would always start the presentation with like a slide or two of some big government report or intergovernmental report, sort of legitimizing the whole topic. And now I find that climate change is so connected to people's daily lives, whether it's the floods and the heat waves, droughts, fires that are happening, that people know it's a problem. I don't need to preface what I'm saying by that. And when people think about climate change, they tend to think about it being caused by the transportation sector, perhaps energy use or construction. But they don't tend to think about food systems. Well, it turns out that human food systems account for a third of greenhouse gas emissions. Most people don't think about that, but within that category, livestock is the most important contributor to greenhouse gas emissions. And within livestock, it's beef. Beef, it turns out, accounts for 8 to 10 times the impact as chicken does, or over 50 times the impact on greenhouse gas emissions than beans. And so naturally, we were concerned about beef. If we were going to do an education campaign to let people know about this, we thought, well, who should we target it to? We should target it to the people that are eating the most of it. And so how you would target that? Well, you'd set a threshold for what's disproportionate beef consumption, and then go about looking at some data to see who's contributing the most.
That makes perfect sense. Let me ask you sort of a fundamental public health question in this context. Sometimes you get big impact at a public health population level by making big changes in people who are the biggest users of something. Heavy smokers would be an example, or heavy drinkers. And that's the approach you're taking here. But I know in other cases, some people have said that with some consumption patterns that are hard to change, like maybe what people are eating or smoking or drinking, that it makes sense to focus on a different part of the population where you get smaller changes, but spread across a larger number of people who are more willing to change, and hence you get a bigger impact. How do you think that through? Okay, that makes good sense. So how do you define who were the disproportionate beef eaters and what were the findings of the study?
To think about disproportionate beef eaters, we used the dietary guidelines for Americans. We looked at the Healthy U.S. Meal Plan. The data we had was daily intakes. And so that meant that for somebody with a 2,200 calorie consumption level, that a recommended amount would be 4 ounces for meat, poultry, and eggs. And we thought, well, if you're exceeding the recommended amount with just one of those foods, just beef, where you could be meeting it with chicken or eggs or even vegetarian if you wanted to, but at least in the U.S. plan, it's not a vegetarian plan, we thought that was disproportionate. And so we used that as a benchmark for a disproportionate diet. What did we find?
Before you do that, let's give people some sense of this. So when people talk about a recommended serving of meat, they say something that might be about the size of a deck of cards. Is that the 4 ounces you're talking about? And I'm imagining you're talking about people that eat multiples of that.
You think of 4 ounces as a quarter pounder, thinking about a burger, except that it's cooked. And usually when McDonald's puts out a quarter pounder, that's the raw weight. And so we're really thinking about 1.25 or 1.33 quarter-pound hamburgers. That's what the threshold is. And so if you're eating more than that, more than 1.25 quarter-pounders a day, every day, that's what we're considering disproportionate.
Okay, thanks. So tell us about what you found in your study.
We found 3 kinds of things in the study. First of all, there was 12% of people consumed this disproportionate amount. They were more likely to be men, and they were less likely to be young people under 30 or older people over 65. And they're also less likely to be college graduates. So those are the kinds of things we were looking at when we went into it. The other things that we saw were that those 12% of people, and this is what really surprised us, we weren't looking for this, but what ended up happening, the 12% of people that are the disproportionate beef eaters are consuming 50% of the total beef on any given day. That was the surprise. That's the one that got all the headlines. There's another piece in there that didn't get as much play, but I think it's interesting that when you think about beef, you tend to think about, okay, there's a steak on my plate, or maybe there's a burger on my plate. But the truth is over 50% of the total beef that we saw consumed was in the form of mixed dishes. And I'm talking about stews and soups and burritos and tacos and sandwiches and pasta dishes. That was the other finding, is a lot of the beef that's being consumed, a majority of it is consumed in these mixed dishes, not just on a hunk of beef on your plate.
Well, those are really striking findings, that 12% of people eat 50% of the beef, and that it's clustered in certain demographic groups. Really pretty interesting. I also am surprised by the mixed dishes, because the vision in my head as we were speaking is that people eating hamburgers and steaks and things like that, but the mixed dishes are really an interesting part of the picture. So what do you think some of the factors are that drive meat consumption in some of these groups?
It's interesting. I think young people are more concerned about the planet in general, and so they're more clued into these issues, and that might be part of the reason they're eating less beef. I think older people might be eating less beef because they're concerned about health issues. We haven't talked about that. There's a number of studies. It's pretty consistent, the evidence showing that the connection between red and processed meats and heart disease and mortality. So I think older people might be more concerned about that and therefore eating less meat. College graduates may be just understanding these connections. Possibly that's part of it. I think men over women, because there are some studies that show that meat plays into masculinity. There's also the idea that men are more willing to sacrifice animals for their own good than women are. And these are some studies in the psychology of eating that we don't do this kind of work, but I think it's interesting.
Yeah, this is just from my own observation, and this is in the past more than I've seen it currently. But there was a time when the fast food companies especially were reacting to messages that eating meat wasn't very healthy. And the kind of messages that they were putting out at the time was, don't let anybody tell you what to eat. Be a man, stand up, eat our massive burgers. And, I imagine that all these things are linked together, aren't they? The marketing practices, the masculinity, the imagery, all of it's a pretty complicated set of topics.
It is. And I think they are connected, as you point out. And that makes it all the more challenging to try to do something about it.
So back to your study. So what do you mean by eating a disproportionate amount of beef? I think you defined it already, but is there more to say? And how do you translate your research definition for the public who might be interested in their own consumption patterns?
That's an interesting point, because, we do our research and then we have the challenge of trying to communicate it to the public afterwards. And part of that is there are different concepts. What we do in the research setting is not necessarily related to what you would do at home. And so let me describe how that is. For example, in this study, we're looking at 24-hour recall data. And this is a tool that nutritionists use to get a snapshot of what someone ate on the previous day. And they're very comprehensive. There's a whole methodology around it to get what is in that day's food intake. And that's what we have in our study here, the National Health and Nutrition Examination Survey, which we use. It's a nationally representative survey. So we have over 10,000 adults here that we're looking at a snapshot in the day. And so when we're trying to set up a threshold for what's disproportionate, we take a look at the dietary guidelines for Americans and translate those into one day. And that's where we got this, 4 ounces of beef. More than that would be disproportionate. And so then the question becomes, well, what do you do if you're a consumer? Can I eat, a burger and not reach the disproportionate level. Yes, on a given day. But the way that the guidelines are set up is they're set up across a whole week. And so really the way to think about it is disproportionate in your daily life would mean eating a burger and a third or more every day, not just on a given day.
Okay, so that makes perfect sense. So I appreciate that specific advice. So what are the connections between consumption patterns that you're describing and agricultural emissions and climate change?
This idea of a dietary carbon footprint, it's what's the greenhouse gas emissions inherent in the foods you eat. And it's not the eating that's the problem, it's the producing. That's where most of the emissions come from. How does eating affect emissions? Well, if you eat less of something, then the idea is that that will send a signal back to producers to produce less of it. And so to the extent that the emissions are coming from the production side and you not participating in that would send a message to producers to produce less of it. Now, if that link is broken, for example, and it can be broken if American beef producers export, which they do, then it doesn't help the planet. So in other words, if they keep producing beef and shipping it to Indonesia or someplace else, then it's not enough for us to eat less. It has to be a sort of a global effort.
It does make good sense when you state it that way, that a lot of people making these kind of changes could add up to a big difference given the role that beef consumption is playing in the agricultural impact on the climate. So I appreciate you focusing on that. So what would you say is the broader importance of this topic?
So I think really the broader importance is to point out that beef is a really extravagant source of protein. You can get the same nutritional equivalents, even better, because it doesn't come with saturated fats, not associated with cardiovascular disease to the degree that beef is, if you were to eat chicken. It's like 1/8 or 1/10 the amount of greenhouse gas emissions to produce chicken than it is beef. And if you go vegetarian, even more so. So I think the significance is that there are little changes that can be made that would add up, and they can come in from lots of people, and they can come from lots of ways in anyone's diet.
Well, Diego, this is important research, and I'm grateful to you and Dr. Willits-Smith for doing this study, which was published in the journal Nutrients, by the way. So thanks so much for joining us.
Thanks for having me.
So our guest today has been Dr. Diego Rose from Tulane University, and thank you for listening. With special thanks to Deborah Hill for her inspired work as producer of this series. If you'd like to subscribe to Leading Voices in Food podcast series, you can find it on Apple Podcasts, Google Podcasts, or your favorite podcast app. Podcasts and also transcripts of the podcast are available on the website of the Duke World Food Policy Center. This is Kelly Brownell.